And I'm not going to go too much into the background because I'm sure a lot of you are aware of it already. Save us to say that it was very much part of a renewed partnership between Irish Aid and Global Health, the HSC, and Mozambique. And following a very successful Train the Trainer programme, which the HSC had sponsored through Global Health with the consultant Dr. Peter Lachman, the Ministry for Health in Mozambique identified that they had a problem with pressure ulcers and the pressure ulcer prevention within their hospitals in Maputo and indeed across the provinces. So this photograph here, there's 4 very important people in that photograph and not the one in the middle. And the reason for that is that Elenia on what would be your right of the photograph with David Weekliam, Jonas from the embassy and the ambassador of the embassy, and Philip had together, if you like, agreed the objectives for the piece of work last December, which were very much to enable the clinical leaders in Maputo to use quality improvement approaches to improve the safety and care within their services, and also to support the consolidation of learning, which had already taken place through the Train the Trainer programme. So the intervention is still in progress because it's a blended learning approach, which initially started with 4 hospitals in Maputo. So this was bringing together multidisciplinary teams into a workshop setting where, using a quality improvement approach, we supported them in actually designing how they were going to try and prevent pressure ulcers within their hospitals. Since then, we've been using Skype or Zoom, I think more correctly, to engage with the teams at least every 2 months or so, and to support them in that journey. And that's been principally our intervention, with, of course, sharing resources and materials with them. But the real focus of this very quick conversation is around the lessons learned, and probably more appropriately described as the reverse learning. Some of it which we're very familiar with here at home, but a lot, of course, which just reinforce the importance of key concepts and key attributes to effective quality improvement. Principally that of leadership, and which was very evident from the outset was that this piece of work was hugely supported by senior leaders in Mozambique and in Ireland, and I think that was critical to the success of the initiative. Philip shared with me earlier that Elenia, who's an Assistant National Director for Medical Services in Mozambique, said to Philip at the outset, "This is going to be my legacy." So I think that just gives an example of what that attention and endorsement from senior leaders can achieve. Secondly was purpose, passion and innovation. The teams that we met and the teams that we worked at had the most incredible passion for what they were doing. Passion for improving patient care, passion for improving patient safety and for improving everything that they were doing. But they were also exceptionally creative, and I think there was huge lessons for us to learn around this also. In a world of very limited resources compared to what we are probably very used to here, they were particularly innovative. And one of the site visits to the Central Hospital in Maputo, they were using gauze, wrapping up gauze to develop little air cushions to relieve pressure from patients' limbs. Wouldn't happen here, but yet it was effective and successful. Also looking at celebration and celebrating very often, celebrating the very, very small wins, which is very, very important because it's a key motivator for all that are involved. And also networking. Bringing together this group of people from the 4 hospitals, they set up a WhatsApp group. And this WhatsApp group has been instrumental, I think, in mobilizing and energizing and keeping this initiative going. I think what's particularly helpful about it, not only are they sharing their experiences of what they're doing in practice, but they're also sharing a little bit of themselves. So they're bringing that human flourishing and that human being into the workplace as well. And they also offer high challenge and high support. So they pick each other up on things when it's not going so well, and it really is a very, very positive way of connecting with each other and of establishing that network. You see in the 2 photographs there, one is from the group that convened last December at the workshop for pressure ulcer prevention, and the other group for the Train the Trainer programme. A few people have actually participated in both, and that's been really important around developing those champions and those experts who can support their colleagues back in their hospitals. Did I miss one? Sorry. Staff engagement. What was again something we struggle with staff engagement an awful lot here, and it's something that there's been relentless work and very successful work through the Quality Improvement Division and HSC HR. But what was notable about our experience in Mozambique was that regardless of your level within the hospital, regardless of where you worked, that offering for communication and involvement was out there. And all of the pictures, or indeed the majority of pictures that I'm sharing with you today, are pictures that have been shared by the participants on their WhatsApp group of how they're bringing people together to learn, to share the learning and to improve patient care. Governance, again, which is very important, and I think this, again, through LNE and the work of the ministry, was giving that autonomy and giving that endorsement to the senior leaders in the hospitals, in the Maputo hospitals, to actually put this on their agendas, their executive management board agendas, and to make pressure ulcer prevention using quality improvement approaches a priority. With that attention, success tends to follow because it's very much on their radar, not just during the implementation phase, but also for sustainability and spread planning thereafter. The methodology was also very important, and you can see down here at the end, and there's also a banner around the framework for improving quality. It's translated into Portuguese here. We used that very much to shape how we were sharing the improvement science approach through the workshop and indeed through the Zoom calls that we have with them. And this, I think, has been very successful, ensuring that key drivers and key areas are considered. Again, having an approach, it brings people together, it gives a pathway, and it gives a structure to improvement. And there's been great evidence shared, again, primarily through the WhatsApp group and through the Zoom calls, of how these groups of people have used the model for improvement and that improvement science approach to achieve change. So the key messages, I hope I'm on time, Philip, is that senior leaders' commitment to the journey in its entirety. So it's not just throughout that implementation phase, but it's apt to see it to its end, and that is to include very much sustainability and spread. The local ownership and the power of local ownership when you involve the frontline teams in quality improvement. And I think the fantastic results from multiple areas and multiple spheres is testament to that today. The methodology, and this is key, I think, certainly in terms of the bring home or the reverse learning and take home message. Keep it simple. Don't overcomplicate things. And this is something that I've started to do actually since I've been over there. Keep it very simple, keep it very relevant, and always remember context. Build will, celebrate, and be proud. The people that have been involved in this to date are very proud, and they absolutely should be. They are so proud that it's almost an automatically willingness around them for other people to become involved and to spread. And finally, that I think this initiative provides strong evidence to show the power of these sort of partnerships and the reverse learning, that it is very much a two-way partnership. So thank you very much.